Good afternoon. I think it may be helpful for some of you at the back to move forward. If you really want to know how to win the next 100 million, I'll suggest you move a little closer. My name is Shola Olopade, and Professor of Medicine at the University of Chicago, and I direct the international programs at the Pritzker School of Medicine. I also serve as the co-director for the university's Center for Global Health. And as a co-organizer of this 10th CUGH conference, I'm happy to welcome you to our closing plenary session, highlighting perspectives on 100 and change, the John D. and Catherine D. MacArthur Foundation's global competition for bold solutions to critical problems of our time. The John D. and Catherine D. MacArthur Foundation is one of the nation's largest independent foundations. Organizations supported by the foundation work in about 40 countries. In addition to Chicago, MacArthur has offices in India, Mexico, and Nigeria. The MacArthur Foundation supports creative people, effective institutions, and influential networks, building a more just, verdant, and peaceful world. MacArthur is placing a few big bets that truly significant progress is possible on some of the world's most pressing social challenges, including over-incarceration, global climate change, nuclear risk, and significantly increasing financial capital for the social sector. In addition to the MacArthur Fellows Program, the Foundation continues its historic commitments to the role of journalism in a responsible and responsive democracy, as well as the strength and vitality of their headquarters city here in Chicago. It's my pleasure to introduce my co-moderator of this session and the woman who is one of the brains behind this fantastic enterprise, Dr. Christine Molyneux. She leads the social impact team for Lever for Change, which provides programmatic and technical support to applicants and grantees. Christine was previously the senior program officer for the Foundation's 100 Million and Change initiative, a competition for a single 100 million grant to help solve a critical problem of our time. In this role, Christine co-developed, designed, and launched the inaugural 100 and Change competition. She currently manages various aspects of the competition, including scope of initiative, the provision of technical support to competing participants, and due diligence processes. Currently, Christine oversees the Foundation's $100 million investment in Sesame Workshop and the International Rescue Committee. Christine joined the MacArthur Foundation in 2013 as a program officer in the Girls Secondary Education in Developing Countries program, where she oversaw the strategic directory of this portfolio. This work included global engagement activities focused on strengthening the policy and evidence base for secondary education. During this time, she also played a very critical leadership role in forming the Partnership to Strengthen Innovation and Practice in Secondary Education, Donor Collaborative, which has granted over $500 million to global educational programs to date. Let us give a warm welcome to Dr. Christine Molyneux.
Thank you very much, Dr. Olopade, for having us here today and inviting all of us to present. We're really honored to be here. Many of you likely know about 100 and Change, especially after that great introduction. But for those of you who don't, 100 and Change is a competition for $100 million to fund a single proposal that promises to make real and measurable progress towards solving a critical problem of our time. 100 and Change is an open and transparent competition that is global in nature and is sector agnostic. And we are looking for projects that are impactful, that are durable, that are evidence-based, and that are feasible. And we often get asked at MacArthur, why did you guys decide to do this? Why run a competition? Why $100 million? So back in 2015, we were going through a bit of a transition at the foundation, and we recognized that while MacArthur strives for transformational impact in a few areas of profound concern, some of which Dr. Olopade referenced, our journalism and media work and our incarceration work, we also, our board and president also stopped and asked themselves, can we do something bigger? Can we do something bolder? What could we do to attack a bigger problem of our time? Could a large amount of capital make significant progress or solve a problem? Could a competitive platform actually inspire fresh collaboration and new thinking and new types of partnerships in order to solve critical problems? We also wanted to address the common critique of foundations as being these black boxes where staff tend to go off and define a strategy and set the strategy, and then they go and look for organizations that fit that strategy and can help us get to impact. And so we wanted to turn that on its head and to be a little bit more humble, and we wanted to look outside of our own institution and outside of our own current networks to see whether or not other ideas about what was the most pressing problems would bubble to the top and what were the best solutions out there to solve those problems. And we felt that a competition would be a great way to inspire that bigger thinking, those bold ideas, and to surface new things that we didn't know about. And that is exactly what happened. Through the process, we received over 1,900 applications from around the world. Those 1,900 applications were whittled down through multiple judging and assessment processes to the 4 powerful organizations that I am honored and proud to share the stage with today. Harvest Plus, which is eliminating hidden hunger through fortifying staple crops. Catholic Relief Services, which is focused on changing the way we care for children in orphanages and institutions. Rice University's Nest 360 project, which is focused on improving newborn survival rates in Africa. And Sesame Workshop and the International Rescue Committee, which is providing early childhood learning and care for children in the Syrian response region. These 4 organizations are doing incredible work to support the health and well-being of the most vulnerable children around the globe. And while MacArthur did not set out specifically to focus on children's health, these 4 organizations, with their bold proposals, their strong track records of stellar work, their dedication to achieving impact, and their incredibly strong partnerships, combined to bring them to the forefront of all of the many worthy proposals that we received. Today, they are here to share their work, their insights, and their progress over the past year. And without further delay, I want to invite our first presenter, Shannon Sennefeld from Catholic Relief Services, to present on changing the way we care.
Wonderful. Thank you all so much for being here. It's a true pleasure to be with you today. I'm excited to tell you a little bit about changing the way we care. First, I want to say that when MacArthur released the call for 100 and change, it was a huge, exciting moment for most of us in the work of international development. And Catholic Relief Services, we're active in over 110 countries around the world. We do work in almost every sector. And so we started to think to ourselves, what is the one thing? If we have to pick just one, what's the one problem that we want to solve, and how do we do it? And we came up with changing the way we care. So let me see, does someone advance these for us? Do I do it?
This green one should move it.
Thank you. Technology is not included in my forte list. So our vision under Changing the Way We Care was really to create a world where all children would thrive in protective family environments. We know that there are over 8 million children living in orphanages around the world today. The fact is, we don't have an exact count because these children are truly among the most vulnerable population in the world and are not truly counted. They really don't have a voice. But we know that every child is important, and we feel called to protect those children who are truly the most vulnerable. With more than 8 million children living in orphanages around the world, we know that 80 to 90% of these children have a living parent. It's crazy to me, having started off working in international development and not understanding the issue. I truly thought in the beginning that children who lived in orphanages were truly orphans, meaning that they didn't have a living mother, a living father, or a family member who might be able to take care of them. But in reality, most of the children who are living in orphanages around the world today do have a living parent. Oftentimes they're placed in orphanages because of poverty, the parents' lack of money to care for them, or lack of access to basic skills or basic things like education and health care. So that's very sad, the fact that there are children who are living in institutions away from their families when they actually have families who would be willing and able to care for them if they just had some resources available to do so. It's even more sad because the evidence is really clear that living in institutions actually has a negative, profound, lasting effect on children. It has an effect both in the short term, where we see that these children are more likely to be emotionally and physically stunted, but also in the long term, where we see that it actually impacts their overall intellectual development, their possibilities for future employment, and their long-term attachment and bonds to others. We also know that it's not cost efficient for children to live in orphanages. It actually costs up to 10 times more to take care of one child in an orphanage as compared to taking care of that child and supporting that child to thrive in his or her family. So just for example, if you take the case of Haiti, currently there are approximately 760 orphanages and about 32,000 children living in those orphanages. We know that from the United States alone, we send, well-meaning Americans, we send over $100 million every year to support orphanages to care for these children in Haiti. We're doing it with the best of intentions. We mean to do well. We want to help poor and vulnerable children. But the fact is that that same amount of money could be reinvested to support 340,000 children to have access to an education while living at home with their parents. This example is especially near and dear to my heart because I actually started working with international development and became really involved in children's issues while working in Haiti. And I remember going to the orphanages that we were supporting at the time and doing some monitoring visits. And one time I showed up and there weren't any children at the orphanage. And when I asked where all the children were, the orphanage director told me that they had gone home for the holidays, which was lovely, but was really mind-blowing, the fact that they could go home for the holidays. Like, if they have a home, why aren't they there? And so that was very an eye-opening moment for me. And I think it's hard. We have a lot of cognitive dissonance, especially in the US, over this issue, where we don't want to believe that we're supporting the wrong thing, but the fact of the matter is we don't know all of the issues. And it's really through this project that we've been able to bring light to some of these issues in particular. So our premise is that institutional care is generally harmful. We recognize that there are a wide range of institutions out there, and I'm sure that many of you in the audience will tell me that you've been to an orphanage overseas and that the orphanage that you were at is really good. And that may very well be the case. But even if there's a good one, there are 10 more behind it that aren't. And even if you had a good orphanage, if it were your child, would you want your child raised in that good orphanage, or do you want your child raised with you? And the fact of the matter is that we know that children do better in family care. As long as the families are good, as long as they can provide the support that's needed, we know that children thrive better there, and that we can actually help more children to survive in family-based care than we can in institutional care. So our solution was three-pronged. It was that governments be supported to provide family-based care, that family-based care be supported and promoted globally as a first option, and that children stay in family care, or in those cases where they've already been separated from their families, that they return back to family-based care. Our solution includes a variety of options. What we would like is to make sure that the children are not placed in the orphanage as a first solution, and that the future solution is that these children are living independently as productive, healthy adults later on in life, and that in the meantime, they're thriving in supportive and protective families. We recognize that there are some short-term needs. Of course, not all children, even in the US, we have foster care, we have group homes, we have a variety of things, and we think that that variety needs to be there. But recognizing that the family-based care is actually the best option for children, be that in a foster care, a kinship care, or with their parents of origin. Our approach involved originally supporting or applying for doing this in 7 countries, 1 country in every region, so that we could demonstrate the effectiveness of this approach and that those countries can become advocates for the other countries around them. So we intentionally chose different countries from around the world, 7 in total. We are fortunate enough to be one of the semifinalists and receive funding from MacArthur as one of the semifinalists to initiate this work. And so we've begun work this year in 3 of the countries. We're working in Moldova, Kenya, and Guatemala right now. And in the future, we fully expect to expand to the other 4. Our approach is that we have to work with those countries to make sure that we have laws and policies in place, that community and family services are available, that philanthropy is redirected, because we actually know there's enough money in the system already. So the reason that we needed the money in the beginning was not because there isn't money. It was because this system's already been built up, and we knew we needed to build up the alternative system at the same time. So we didn't want to have an approach where we just shut off the lights and all orphanages are closed tomorrow. That's not going to protect any children. But we knew that we had to build up this alternative care system that included child protection, social workers, social reform, working with the governments, making sure all the policies were in place, et cetera. And once that secondary system was built, then we could redirect the philanthropy to support that secondary system. And then, once that was in place in the 7 countries, or in the 3 countries that we have now, to build on that work by expanding the work to other countries in the region, which will then change the momentum. We call it our tipping point, because once we get enough countries on board to move in that direction, it will happen. And indeed, we're already seeing that movement take place. So I will conclude, because I don't know how much time I have because I forgot to press my timer, by saying thank you. And a huge thank you to MacArthur, because one of the things that was so critical to us in this was that people actually started to become aware of the problem. And once people are aware of the problem, we find that the desire to engage in the solution is immense, and we are overwhelmed by the compassion that we see regularly now with people reaching out to us to say, let me be part of the solution and tell me how I can be part of the success of this moving forward. And MacArthur really provided the platform for us to bring this message to a very large audience by its 100 and Change competition. So almost more important than the money was the actual recognition that this was a problem, and it was one that needed to be solved. So thank you.
Great, thanks Shannon. Always so inspiring to hear about your work at Catholic Relief Services. My name is Kara Palamountain. Okay. My name is Kara Palamountain, and on behalf of the NEST 360 team, Newborn Essential Solutions and Technologies, I want to thank the audience here at the Consortium of Universities for Global Health for sticking with us here in this last session. I also want to thank the MacArthur Foundation for providing us the opportunity to be inspired and think bigger than we normally had. I am representing a broad team, a multidisciplinary team of 8 universities from 5 countries and 3 continents. We are a team of unlike minds. We have engineers, we have clinicians, we have entrepreneurs, we have distributors, we have product designers, we have policy and implementation research experts. We don't always speak the same language, except for one thing. We are all committed to reducing newborn mortality in sub-Saharan Africa. We have one goal that aligns us all across our disciplines. So thinking about the problem that we're tackling, there's about 2.6 million babies globally. And to give you context, about 1.1 million of those babies globally that die are born in Africa. And we know the 3 main causes of these deaths. So the good news is that we actually know what are the causes of the problem. In short, a baby is either born too soon, so they don't necessarily have the organs to support their bodies. They might have an infection on board, so their immune systems aren't fully developed. And finally, they might actually have complications during delivery that occur. And so these are the 3 main causes of death, and we do know what they are. probably because of a lot of the research done by people in your universities. The other bit of good news is that we have the evidence and the knowledge and the tools to address these causes of death. 75% of newborn deaths are actually preventable. So that's the good news. The bad news is, why haven't we done anything about it? And how are we going to make this go away if this is truly preventable? If you look at the causes of morbidity and mortality, and there's in sub-Saharan Africa right now, there's about 30 babies that die for every 1,000 live births. That is what the morbidity, the cause that we were at 30 per 1,000 births here in the U.S. in the 1940s. In the 1940s. And in 80 years, we've gotten down to 3 deaths per 1,000 live births. So in 80 years, we've accomplished that. But if we continue with business as usual in sub-Saharan Africa, it's going to be another 110 years before a baby born here in Chicago or in Malawi has the same chance of survival as a baby born in Chicago. So this is unacceptable, and we want to accelerate the rate at which we reduce this morbidity. So what we're focused on is in three areas. How are we going to bend the arc and accelerate? In short, we're going to provide the knowledge and the tools that we actually have and have had over the course of the last 80 years and make sure that they are designed specifically for these environments. In addition, technologies, just for technology's sake, are useless if the workforce that you're giving them to doesn't know how or when to use them, and more importantly, when they break, how to fix them and maintain them. And finally, how do we actually implement this at a scale that will make a sizable dent in the deaths that we're seeing continent-wide? So I'll focus first here on the innovation piece. This is an army of oxygen concentrators sitting in Queen Elizabeth Hospital in Blantyre, Malawi. Oxygen is one of the most important tools, not only for day-to-day breathing, but in a hospital, medical-grade oxygen is one of the most important things a ward can have. And this army of oxygen concentrators are all not functioning. With good intentions, they were donated to this hospital, but unfortunately, they weren't designed for this hospital, and moreover, they weren't paired with a service and maintenance plan to go along with them. So unfortunately, they sit in one of the biggest rooms in the hospital, just waiting and sitting there and going unused. So with regards to innovation, what we need are technologies that are gold standard, that are just as effective here in the US as they might be in Malawi. We want them to be highly sensitive and specific of their diagnostics. We want their performance levels to be not less. But also on top of that, we need technologies that are affordable. Their price sensitivity in health systems in the geographies that we work in are extremely sensitive. And we need to make sure that effective technologies are actually affordable. And finally, we need a sustainable way to maintain these technologies in the system. We need people that can absorb them in a sustainable way. What technologies do we need? Right now, we've done a really good job of trying to scale up basic newborn technologies. So we have antibiotics, we have steroids, we have chlorhexidine, some very basic tools. But if we really want to get down to the mortality rates that we're talking about, 3 per 1,000, we need to start thinking about a comprehensive set of more comprehensive technologies. So technologies that can help a baby breathe when their lungs aren't fully functioning, like a CPAP machine, pulse ox. We need to help manage unformed livers through managing and diagnosing jaundice. We need to be able to keep babies warm through radiant warmers and temperature monitors. And we need vital signs monitors that tell us the basic reasons why clinicians should pay attention to this baby versus that baby, and monitoring them. And the good news is that many people actually in this room are probably designing technologies specifically for these settings. And our team scoured the marketplace and found at least 8 commercially available technologies that have been designed specifically for these settings. The bad news is that we don't have a complete set of technologies, and we need to complete the bundle. And so this is sort of a call to action to any product developers in the room that are interested in making new things that can have a high impact. This is by no means a comprehensive or a static list, but this is where we're starting from. So by 2022, the goal of our project is to source these technologies that are commercially available and strengthen the supply chains that support them, making sure that we can get them from the manufacturing doorstep where they were made to the clinic, and more importantly, that they can be maintained. So if we need spare parts or ongoing commodities, we can make them, that supply chain work. Our goal is to equip 265 hospitals with this technology. But technology for technology's sake is useless if you don't have a group of clinicians or technicians that can actually adopt them into their day-to-day. When we think about the disparities between the number of healthcare workers per patient here in the US versus what we see in sub-Saharan Africa, it's stark. So we cannot ignore education at all. We think about education in the NEST 360 project twofold. First of all, there's clinicians. There's clinicians in nursing schools and colleges of medicine that we are partnered with, providing them with curriculum to address when and how to use life-saving interventions is where we're at right now. And we've started that in Malawi with breathing support tools. But there's already a bundle of healthcare workers that are actually already working in the hospitals. So we're training them to use the breathing support tools as well. And in short, our goal is to not only train them, but train the people that support them. So the biomedical technicians that service and maintain these technologies, we're also partnering with schools in each of these countries that we're focused on. Our goal by 2022 is to train 17,000 clinicians on how and when to use these technologies through the network of partnerships that we've established. We're also implementing technical education programs in the technician and engineering schools that we're partnered with. Also working hand in hand with ministries who have their own service and maintenance technicians. Finally, thinking about implementation, how do we take these devices and the workforce training tools and scale them? The way we're thinking with the end in mind. First of all, our goal is to achieve SDG 3.2, focused on newborn mortality reduction. And we want to do this across the entire continent of Africa. We spent 2017, 2018 coming up with our plan. And on January 1st, we started. Where we're starting first is in Malawi. And then we're moving, we're in 40 district hospitals installing respiratory care support products already, and we're rolling out the rest of the bundle right now. We're taking what we learn in Malawi and applying a blueprint to 3 other countries that we're working in: Tanzania, Kenya, and Nigeria. These countries are picked specifically because they're all very different. So Malawi is actually the whole country is the size of Lagos in Nigeria. Nigeria is huge and has many people, so that's very different. Tanzania is similar to Malawi in that there's a vast public health care system, but it's a very, very large country, the size of 3 states of California. Kenya, even though it's a neighbor of Tanzania, they share the same Swahili tongue, is also very different. So there's a much more active private sector set of hospitals that we need to be working with as well. But the goal is to apply the blueprint in Malawi and customize it for the blueprint in the 3 other countries, figuring out what changes and what levers we need to do differently. It's notable that all 4 of these countries, plus the next 4, have all committed to reducing newborn mortality by 50% in hospitals. So this political will starts at the top, and it's actually strategically why we selected these countries to start with. We will apply what we learned from those 4 countries to the other West African and East African countries that we're partnering with, so it's scalable as well. And then finally, that leads to catalyze continent-wide adoption. What can we learn from everything we did in these 8 countries, and how can we ultimately get to our goal where 16 million babies are born in facilities that are supported with technology and healthcare workforce that can support a newborn mortality reduction by 50%. So this is a bit of a call to action, reaching out to you guys. We're focused on innovation, education, and implementation, and I know we have some experts here in the room that we can learn from. And we're prepared to also report back to you and have you hold us accountable. So I just want to, for anyone thinking about applying for the 100 and Change program, it was one of the best professional and personal decisions I've ever made. Changed the way I think about solving problems, and I don't think I can ever go back. So I just want to thank you for your time.
Good afternoon. My name is Anna Marie Ball, and I'd like to tell you the work that Harvest Plus has been doing with the support that the MacArthur Foundation through 100 and Change has provided to us. So our project is entitled Fighting Hidden Hunger in Africa Through Enriching Staple Crops. 2 billion people. We're throwing big numbers out at you. 2 billion people suffer from micronutrient malnutrition. That means they don't get enough vitamins and minerals that they need for their development and for their well-being. That means 1 in 3 people, get my numbers right here, 1 in 3 people in the world do not get their vitamins and minerals. I was going to say to you, look to the left and look to the right, but if you did, you might get an empty seat, so that won't work. As you can imagine, this is not evenly distributed throughout the world. Africa and Asia are the areas of the world that suffer the most from micronutrient deficiencies. How have we previously addressed this? Well, first of all, we have to say that the best way to get your micronutrients is through a diverse diet. Hands down, that is the best way. The reality is that many people in this world simply cannot afford a diverse diet. So what are they to do? Well, we know that supplements have been used quite widely. So you can get vitamin A capsules, you can get iron tablets, and they work. Also, we have commercial fortification, so that's where you get the micronutrients added to a carrier, such as oil or sugar or flour, and that too will work. The thing is about those methods is that there's a flow from urban to rural areas. And when your delivery chains run out, you still have people that have not received those things. And guess who those people are? Those are the farmers, the people that grow their own food. And that's where biofortification comes in as a strategy. What is biofortification? Well, this is where we breed in vitamins and minerals into the seeds of the crops. And this is done through conventional plant breeding, and through agronomic practices. And the purpose is to have the density of the vitamins and minerals so high that when you eat them, it makes an impact on your human health, on your nutrition. So 25 years ago, this was an idea. Somebody sitting in the back of the bus thinking, surely there is a way that we can make food better. We know that the poor of the world filled their tummies with staple crops. So couldn't we make this better? Well, indeed, now, 25 years later, we've got 13 staple crops that have been worked on. There are over 340 varieties that have been released in 40 countries and that are being tested in another 20. So this really is a global movement. Under the 100 and change competition, we suggested that we would like to work in 6 countries in Africa with 4 of the biofortified crops. So that is the orange sweet potato that has vitamin A, cassava that has vitamin A, maize with vitamin A, and beans that have high levels of iron. You can see that I am a fan of orange. So just to give a little bit of background, and my colleagues, or our colleagues from Africa will recognize this. At the top of the picture is white maize or white corn. That is dominant in Africa. At the bottom, you will see some yellow corn or yellow maize. Now, this was used as food aid. And people have very, very unhappy memories of food aid. So when we were breeding the vitamin A into the maize, we knew that there had to be a very distinct color from yellow. And that's what you see in the middle, is the orange maize. So sweet potato, cassava, and maize change color when you breed in vitamin A. Beans, you can breed in higher levels of iron and you won't know a difference. So, what do we know about biofortification? Well, we know it's very cost effective. We know that it can be done, and that was the first question that we asked was, is this even possible to breed in micronutrients? What we know is it's expensive to do this with plant breeding, but you only have to do it once. And so you do not have a recurrent cost. Whereas with supplementation and with fortification, you must continue to pay to put these things in. With biofortification, once the trait is in there, it's there. We also know that when you're doing this and you're breeding these crops, these varieties, you must breed for the characteristics that farmers want. And what do farmers want most of all? They don't want nutrition. They want to know that they have the yield that they expect from that crop. So first of all, you breed for yield. Second of all, you breed for disease and pest resistance. And then you put the nutrients in there, and that becomes the plus. And we're able to do that. And we now know that farmers will grow and will eat, consumers will buy and will eat the biofortified crops. So because we provide the evidence, if any of you are nutritionists, I have to say that you are the toughest group of scientists I've ever worked with. You do not want to accept our word. You want it published in peer-reviewed journals, and that's what we do. So here's what we know. Vitamin A cassava does improve the vitamin A status of the rural children in Kenya. Vitamin A orange sweet potato reduces the duration, the prevalence and duration of diarrhea of children, for children in Mozambique. We know that vitamin A maize improves the vitamin A status and the night vision of children in Zambia. And finally, we know that high iron beans improve the iron status, the physical work capacity, and the cognitive functions of young women in Rwanda. This is all published evidence. So what I'd like to do now is I'd like to just give you 3 or 4 strategies that we've used in the past year to get these crops out to people in the various countries. And to say that in the past year, through those 6 countries, we've been able to get planting material, the seeds, to 3.5 million households, and that comes to 14.6 million people who now can eat and grow and eat biofortified crops. And through the support that the MacArthur Foundation has given, that represents a 33% increase from what we were able to do in 2017. So one of the things that is really common, or that is common through the 6 countries that we are working in, is recognizing that school children are really important. They are our present and they are our future. So let's educate them about nutrition, show them what can be done. So in Zambia, we ran a school contest for school children. Many schools have enough land where they can grow crops, and so in Zambia they grew the orange maize, vitamin A orange maize. And the winner was Chipapa Primary School, and they got a hammer mill so that they could grind their maize. We know that it's very important to reach markets with crops. This is Placidi. She sells beans in the market in Kigali, in Rwanda. And as she got to know about the high iron beans and started educating herself, she started to sell them and become a voice to the consumers. And she was so convinced that this was a good idea that she actually took out advertisements on the local radio station so that people would know where they could get these high iron beans. And she currently sells 50 kg a day. That's over about 110 pounds a day of high iron beans. You can imagine what that does to her livelihood. But she has become a trusted voice to her consumers. And what we know here is that if a woman eats beans twice a day, for many of you, you'd go, I would never eat beans twice a day. However, in Rwanda, beans are essential, and eating them twice a day is not unusual. A woman will receive 75% of the iron that she needs through those beans. How do you reach farmers? Well, we work through farmers groups, but we also take advantage of any large gathering that is going to take place. Zambia hosted an agricultural expo last year, and so we made sure that all 4 crops were represented. Planting material or seed was there. Specialists were there to be able to talk to farmers, and they were able to see what the crops look like in the field, and they were also able to see what they can do with those crops in terms of processing. Nigeria, being a brash country, took it up a notch. And one of the ways that they decided that they would reach more partners was to host a nutritious food fair. And they brought in public and private partners. We had government, we had school kids, anybody could come to this nutritious food fair. And essentially it was to expose them to the biofortified crops, but everyone was invited who was interested in nutrition, and they were able to have their own displays. The run-up to that food fair was preceded by a televised competition for school children called NutriQuiz. And this was hosted by one of the Nollywood famous names, who has become quite outspoken in his support of the vitamin A cassava. And if you're into Nollywood films, you'll find at least 3 of them that feature the vitamin A cassava in them. The Ministry of Finance also launched a program called Smart Mothers. And so this became a focal point for a lot more people to be informed and involved. As you can imagine, with this kind of work, you do look to have policy support at an international, regional, and national level. And I would just like to say that within Africa, we've been working with the Africa Union, and we expect that in 2020 there will be a continental declaration in support of biofortification. One of the things about being in the competition was that we were able to look at our work in a different way and be able to frame some things differently. One of those things was that the biofortified crops, by having the micronutrients in them, are actually preventing disability and disease. They are also preventing premature death. You will notice that there is a theme with all four of us here, and that is that children are really very important. Women and children benefit a lot from the micronutrients that are in these crops. We also are very conscious of working with women. Farmers in Africa tend to be dominated by women who are growing food. So you want to make sure that the way that you reach farmers is very inclusive. And we have adjusted some of our programming so that the obstacles that might have been there for women to participate are removed. And they are able to participate, they are able to have access to the seed. But the thing is, you don't want to only reach women, you do want to reach men too, because there is the aspect of control of resources within the household. So you do want women and men to have the nutrition messaging, but also the agronomic messaging. One of the other things that you may or may not be aware of is that with rising CO2 levels, our crops are losing their nutritional values. And that's actually quite alarming, because the people that are going to be most affected by this are the ones that live in the world's poorest places and who cannot afford diverse diets. So what we know is that biofortified crops are a proactive intervention. And as I have mentioned, we breed for high yields, and we breed for heat and drought intolerance so that these crops will be good into the future. I would be remiss if I did not call out the SDGs. There's a direct impact on number 2 and number 3, and there's an indirect impact on 6 other SDGs. So this is quite important. And as I finish, I would like to encourage you to go to the Harvest Plus website. We just launched a new campaign on Friday, on International Women's Day, called Ironworks. And this shows how the crops that have iron, such as the high iron beans and the pearl millet, how this makes a difference to the people that are consuming them. So please take a look, put this out through your networks, educate yourself about what a difference biofortified crops could make. I want to say thank you again to the MacArthur Foundation through the 100 and Change competition. As Cara has said, this has made us think differently, made us think bigger, and we have a goal of reaching 1 billion people by 2030. So we need everybody here to participate with us in whatever way that you can. Thank you very much.
How do you want to stand? Can you see okay?
When I present, I can
It's okay like this.
okay,
Yeah,
all right.
okay. So the challenges of partnership. Thank you so much to CUGH and to the MacArthur Foundation for inviting us to be here to give an update on the Sesame Workshop and International Rescue Committee partnership and project. It's really been a privilege, and Manar and I are so excited to be here.
So my name is Manar Shukri, and I am from Jordan. I'm based in Amman, and I work for IRC, International Rescue Committee, partnering with Sesame Workshop on this challenging and ambitious project. I'd like to put you in the context a little bit. Around 65 million refugees are displaced all over the world. 12 million of them are children. Less than 2% of all the fund geared to humanitarian responses are for the education sector. Fraction of that is for early childhood development. While we all believe and we all know the lack of proper experiences in the early years, it affects the child development at the long run. I would like also to add that 11 million Syrians were displaced during this crisis, 6 million internally, and 5 flee to neighboring countries. Majority of them flee to neighboring countries, including Iraq, Jordan, Lebanon, and Turkey. I would like you also to know that in a time, quarter of the population in Jordan were refugees. Half of the population in Lebanon are refugees.
So that's the context that the IRC and Sesame Workshop considered together and around which we decided to partner. We knew, and I should say that I'm representing Sesame Street, but we knew at Sesame that there was no way we could effectively respond to the refugee crisis without an on-the-ground partner, without a partner who was experienced in delivering a wide variety of services that are related to early education and development. And of course, the IRC is one of the most established and one of the most respected refugee response organizations in the world. That allows us at Sesame to bring what we do best, which is child-facing media and informal education. So really, it was thinking about this crisis and thinking about what this crisis called for that brought the IRC and Sesame together. And actually, the partnership did form prior to our involvement in the 100 and Change competition. It was that 100 and Change was really, just this enormous opportunity that would allow us to realize the potential of the partnership.
صباح الخير.
صباح النور.
كيفك؟
هلا.
Our early childhood program begins in the home. Whether it's a shelter, a tent, a crowded apartment, it doesn't matter. كيفك يا أمين؟ The most important thing is that the children need to be with their parents, the first caregivers with whom they will build trusting relationships and learn new things in order for them to be able to build knowledge on the long run. Okay. We give them activities to promote reading, learning the alphabet, counting, a lot of language skills.
تبعت الغسيل شو اسمه؟
كمان الغسيل.
سلس.
We empower the parents with skills to support their child's development. They can play with them using objects that they can find in their homes.
4 5 6 7 8
We show them how to communicate with their children frequently in a way that promotes praise.
Bravo.
Most of the parents that I work with, when we first meet, they describe their role as shelter provider, food provider, as the one who's making sure that their children survive. Yet with time, they start engaging with their children, and they would say, I used to do this in Syria, but I was not able to do it anymore with my kids. Thank you for helping me.
أصابتني عقدة نفسية حتى حنان لهلا تحسيه على طول روح قربوا من المدارس، هنيك ما عاد فينا نبعتهم على المدرسة. ولهلا بس بشوف ويسمع بحس ضرب أو ألعاب نارية، غزايف يعني. هون ما في شيء ماما، هون عادي طبيعي ما عنا، مو مثل بسوريا.
اليوم موعد حفلة عيد ميلادي طنطن.
نحن بنعرف إن الأطفال إجوا من بيئة مختلفة، بيئة فيها حرب، شافوا أشياء ممكن إنه خوفتهم، يعني في عندهم حالة إنه غير الأطفال العاديين اللي هن رايحين على المدرسة، فنحن لحتى نرجع لهم ثقتهم بنفسهم بدنا نحاول نحن نعمل لهم هيك كلهم، نأمن لهم المكان الآمن، نأمن لهم البيئة الآمنة لحتى هن بيشعروا بالثقة. والمدرسة مأمنت له هالشيء، فهن أكيد رح تأثر بالمستقبل، رح يبنوا مجتمع، أكيد رح يكون المجتمع أمني، مجتمع فعال أكيد.
بسام عبط طنطن، اترك ايدها. عبط طنطن.
Thank you. I always say, actually, that our videos and our media capacity makes it much, much easier to present because we get to rely on these beautiful edited films to tell the story of a lot of what we do. So in terms of giving an update of what's been accomplished since our partnership was awarded the $100 million, we have created a program named Ahlan Simsim, just the local brand, the name of the show, and it will encompass the characters and the television and also some of the print materials that we create together. And we've started to plan the mass media. I'm going to just talk a bit about the mass media and then turn things over to Manar to describe what's going on the ground with the direct services that IRC provides. So what we've learned so far is where there is need and where Sesame can help to fill a gap is around a curricular focus on recognizing and responding appropriately to diverse emotions. We've learned through research that emotions tend to be sort of lumped into happy, sad, and angry. And children often respond to these experiences physically. And we're trying to increase the range of emotions that children are able to recognize, as well as the healthy and appropriate ways that they can respond to and express those emotions. Season 1 of the program of Ahlan Simsim on television will include 26 episodes, and then following that, seasons 2 through 4 will be 52 episode seasons. The target audience is children ages 3 to 8 years, with the sweet spot being children 5 and 6 years. So show will be appropriate for that broader range, but when we think about, who are we going to test the content with, who are the learning objectives really catered to, we're thinking of the children right in the middle of that range. And one thing that's always exciting to mention, we are creating 3 new Muppet characters, one who will be new to a community, one who is existing in that community already and is welcoming the newcomer, and then for a bit of charm and occasional comic relief, we'll have a small goat character who you see next to Elmo there. And I'm not sure exactly when we're officially revealing these characters, but they're doing very, very well and coming to life.
Ahlan Simsim project has direct services that we implement. They differ by the type and the intensity and the delivery. For the types, we have 2 types of programs, one targeting caregivers, parents, and one targeting children. Targeting caregivers, it's working with parents to enable them to extend learning opportunities at home. And programs targeting children, they are programs that focus on improving children's academic, social, emotional skills. The program intensity is very important in this context. if parents and children are able to commit for longer period of attendance in a program, then we implement with them something we called high contact for longer duration and longer frequency. But in many situations, refugees cannot commit to come every day to one place for a long time. So therefore, we have the low contact model, which is compressed of objectives that we work hard to achieve. This model could be integrated in any other service programs, such as protection, social welfare centers, or health centers. Parents and children receive a session about, or multiple sessions about early childhood development and how to work with children to increase the benefit of this program. We also have different types of delivery. Currently, we're using our materials. We integrated Sesame Workshop materials into the existing models that we have, and we're implementing them directly or through other partners that we have initially, in the past partnered with. On the long run, we will be partnering with other national organizations and most importantly with the government, so we can scale up and sustain our work. I talked to you about the models that we have, the caregivers. We have the famous Reach Up and Learn program, which has real evidence-based. We work with the parents of children 3 and below through home visiting. The frequency is about one visit per month over a year, so around 12 visits. And we have that reflective relationship between the visitor and the parents. We have also modular parenting sessions, which is integrated into other existing programs. And this could be like a quick message about the importance of early childhood development and what to do as a parent to maximize the potential of the children and get practical tips to work with your child. We have also a parenting tips and mobile support. That's tips that can be circulated to parents through applications using their own mobiles. We also have the child-facing programs. The most common is the formal or semi-formal setting where a child can visit this center for 3 times a week for 3 hours over a period of 6 months. And this could be tailored from one context to another depending on the situation and the systems in countries. And we have a learning and play and learning spaces. Usually children attend those when they are with their parents. Parents are getting sort of a service. They also get this session. They play and they learn academic and social and emotional skills. As I mentioned, we align all our models with the Sesame materials that are appealing for children and engaging.
So I'm just going to give a really quick summary of some of the research and learning that we've been able to do over the last year or so. We have conducted a needs assessment as well as a series of formative research studies. Sesame Workshop's formative research, it's generally trying to make sure that our content is achieving 3 things. One, that it's educationally clear, that the message is coming through and it's what children are taking away after they interact with content. 2, that the content is appealing enough that children will want to use it again. They'll want to watch it again if it's a show, they'll want to read it again if it's a book, etc. And 3 is that it's culturally appropriate and relevant so that it's truly representing what the child is experiencing on a day-to-day basis. So between the needs assessment and the formative research that we've done, I just wanted to give a couple of examples of the revisions that we're already making to sort of give a sense of how we're aiming to do ongoing improvement even as this program is developed and implemented. First of all, through the needs assessment, we found that the importance of modeling kind and positive relationships showed up among both children and caregivers, that parents really wanted their children to see role models who were kind and who were modeling healthy relationships. So the Ahlan Simsim characters that I mentioned before, there are 2 Muppet best friends, and there will also be a set of caring adult human actors who will be on the show. The formative research found a limited range of emotional terminology among children and caregivers, and I mentioned that earlier. That's the issue around all emotions sort of being labeled as happy, sad, or mad, and then being responded to with physical actions. So the first season of Ahlan will emphasize the identification and healthy expression of more diverse emotions. I think there's a set of maybe 9 or 11 emotions that will be featured during the first season. Formative research also resulted in this preference for print materials to feature more female characters, which is very appropriate considering the International Day of Women. But our books, the existing books that we were tapping into for the initial programming, are being revised now to include more female characters and to feature those characters more strongly.
We're busy. We're very busy. In this year, the main focus will be on refining and adapting the program models that we have. In each country, there is a different context that we need to work well around. Just a reminder, we are operating in Iraq, Syria, Jordan, and Lebanon. We want to find innovative strategies to strengthen the mental health component in our program. We also want to make sure that we are inclusive and we respond to the needs of children with disabilities. We're currently working on a scaling strategy because this is important from the beginning, and how we're going to scale and how we're going to partner either with other organizations or with governments. And we have started to collect data for project evaluation. We abide by a reflective model where we implement, we evaluate, and we pause to reflect so we can take the best of what we're doing and we can tailor what we need to achieve our objectives. As an impact evaluation, we have 5 impact evaluations that will take place during the life of this project. One that already has started in Jordan for caregivers high contact. We have already piloted the tools and trained the evaluators. So we were going to implement the caregivers, implement evaluation and conduct evaluation on caregivers directed high contact and low contact, child-directed center-based high contact, and child-directed centered low contact, and also the mass media evaluation.
So thank you so much for the opportunity to present and of course to be on the stage with the other finalists. We really appreciate it and look forward to any questions.
I think what we're going to do is have a slight moderation of, we're going to ask questions of our panel, and then we'll open it up for many of you who I'm sure would like to ask questions directly as a way of refining your $100 million ideas. So I don't know whether you want to start first, Kristen.
Sure. Is this working? Okay.
So I think one of the biggest questions that we often get is about all of you and the work that you're doing is how your projects anticipate scaling through, well, what are the processes or pathways that you think about scaling, and then in particular, how it is that you interact with policy in order to make your interventions effective. So Kara, I was wondering if you could maybe talk a little bit about how you all think about policy, the intersection with policy in terms of your work.
Yeah, so I kind of mentioned it a little bit in my talk, but more specifically, sometimes just setting the goal is important. So in 2014, the World Health Assembly, every country unanimously agreed that we should all focus on newborn mortality reduction and agreed to a 12 deaths per 1,000 goal. So that was important, political will unanimously across the World Health Assembly. 7 countries in Africa then stepped up to committing to accelerating that timeline and reducing mortality by 50% in hospitals. So even more aggressive goals. As we think about next steps then, these countries have put together plans for how to do that. And there are some gaps, policy gaps. So what staffing levels do you need? Are the budgets supporting it? And how do we implement this? Or what equipment lists do we need? But this group of 7 countries is all working to develop those plans in more detail. And we're closely working with those groups as well. So I would say the political will is there, and then actually translating that into implementation is where policy helps, and it's in process.
Great. Abby and Manar, can you talk a little bit about political will and the intersection of policy and how you all are thinking about it with the Sesame work?
It's on, okay. So we already started assessing existing policies to identify what's available, what is not there, so we can advocate for that. We want to work with the line ministries, ministries of education, social welfare, and health, to increase the investment in the ECD sector. And this is very important for all children in all countries, refugees or non-refugees. We're anticipating also that we will be able to advocate, of course with the support and collaboration of all stakeholders, to introduce the integration of ECD is early childhood development, into all humanitarian programs, all humanitarian organization programs, to ensure that we are addressing the problem and preventing the problem from starting. We believe we'll advocate also on, in each country on national level how to best utilize their resources by proper and systematic collaboration between all sectors.
Thank you. I think one of the things that was most striking to me about when I went to do site visits with all of the teams, except for yours, somebody else did your site visit, but one of the things that I think is unique or special about all 4 of the organizations up here is the strength of partnerships and how critical those were for your work. So Shannon, would you talk a little bit about partnerships and how you engage with partnerships in order to achieve the impact that you want to see?
Yeah, absolutely. I mean, Changing the Way We Care is based on a very unlikely partnership. We have Catholic Relief Services partnering with Lumos, which if you don't know who Lumos is, it's the J.K. Rowling funded organization specifically focused on deinstitutionalization of children. And then also with Maestral, which is a consulting company that really focuses on social welfare and social systems around the world. And so those 3 organizations really came together with different strengths to enter into this partnership to tackle this problem together. But that was only the beginning. Then we had to go out and actually get agreement from all of the governments that we were working with that they wanted to actually be fully invested in this and be partners in this with us as well. And then also other donors to make sure that they were on board with what we wanted to do and were willing to redirect philanthropy in the way that we wanted it to be redirected. And then also all of the other faith-based actors that are out there. Oftentimes it's the faith-based community that's actually doing a bulk of the work with the children overseas. And so we really needed to work with them very closely to make sure that they were on board. So working with all of the sisters, of course, and all the sisters that are providing all the great services overseas, but also reaching out and intentionally including other faith-based networks. So we had a large advisory group which included groups like Islamic Relief, American Jewish World Services, Bethany Christian, et cetera. And so we really made a very concerted effort to make sure that, that those partnerships were also in place.
Anna Marie, can you talk a little bit about the partnerships that Harvest Plus has?
I think at the last count, we had 440 partners listed. We're only 150 people. We are not going to reach 1 billion people with our own hands, and so we have to have partnerships in place. And that goes from governments to farmers groups, seed companies, food companies, NGOs, CBOs. We run the whole range of partners, and everybody plays a part in this process of getting seeds to farmers and scaling up in these countries. So I think it's safe to say that biofortified crops won't be taken up unless there are partners, many partners involved.
Thank you. Abby and Manar, I would love to know from you all, what are critical next steps for the Sesame Workshop IRC work over the next year? Are there 3 key milestones or things that you all are working on?
I think they fall into various categories, so choosing just 3 is tough, but some of the main milestones that are coming up are developing and shooting the first season of the television program. Absolutely, we're very excited about that. Manar referenced the research that is just getting underway that is being led by our partners at NYU, and we're really excited to see how that goes and what we can begin to learn from it. And then I'll reference, I'm not sure how many people in the audience are aware, but the LEGO Foundation actually came to Sesame Workshop following the 100 and Change competition and their excitement around that and how impressed they were with what the MacArthur Foundation did, and committed an additional $100 million to Sesame's refugee response work. And so we are expanding the programming in Bangladesh in response to the Rohingya crisis. And we're really trying to figure out, bringing it back to MacArthur, we're really trying to figure out how does this investment by the LEGO Foundation give us unanticipated and really exciting opportunities to amplify our plans in the Middle East.
Thank you. Shannon, what about you guys? What are you working on this year?
Well, not another 100 million, but fingers crossed. But I should also reference that thanks to MacArthur and this 100 and Change, we've had other donors come forward and also commit funds to this issue. Specifically, the United States Agency for International Development, their Displaced Children and Orphans funding has come in with a GDA to help support this work using the MacArthur funds as a match. And also the GHR Foundation has also come in to provide additional funding. So over the next year, we're going to be working on scaling up our pilot countries. And the 3 countries where we are implementing now, we will be working on identifying funding for the other 4 countries that are out there. Lebanon is one of them, so there's a lot of overlap. And so we'll be working on that as well. And then also, finally, I just mentioned that one of the big pieces of our work is also focused on the U.S. and how to reach people in the U.S. who might be inadvertently supporting bad practices overseas. So we're really going to be focusing on U.S. Behavior change and communication over the coming year.
Exciting. All right, so with all the talk of scaling and partnerships and kind of creating these projects that are really trying to have big social impact, I know that you all have been working really, really hard over the last 2 years or more, actually, with us in 100 and change. And so, Kara, I'm wondering if you could give any, if in case everybody doesn't know, we are launching the second round of 100 and change. We just announced it a couple weeks ago. The application opens on April 30th, I believe, is the date. But you can go to the website and find out more information. But for those people who may think about applying, what advice would you give?
Do it. No. Specifically for this audience in particular, you're well positioned to apply. You're experts in your field and experts in global health, so you're well positioned to apply. I guess I would give you 2 things to consider when applying. First, a general audience. For a general audience, a non-expert, is your solution inspiring, and do the general audience believe it's solvable? 2, going beyond the general audience and thinking about your peers or the expert audience. Would your peers, if reading your detailed plans and the team that you have assembled, would they actually believe that you could do it as well? So there's this juxtaposition between speaking and inspiring a general audience, but also speaking to your peers that you're going to constantly face in this competition. So be thinking about how to address those 2 things.
Great. Anna Marie, do you have any other advice?
Wow, I'm glad that Kara went first. That was great. I would say shake your head and get those cobwebs out and think big, because you're looking for a big solution to a big problem. And we're so used to having parameters set for us and writing to that. And I think that you do have to think bigger and go for it. Just do it.
Excellent. Thank you. I think we can open up the floor for...
I don't know whether, I think we'll open it up for questions from the audience. I don't know if you've been doing the math. If you think about it, $100 million is a lot of money. And if you win $100 million and then you get another $100 million, that's $200 million. You know, and all the other runners have got about $15 million with additional pledges of more money. So I'm hoping those of you that are here today will really, really think big about ideas that will be very, very transformative and that would have global impact. So with that, I'll open the mic so that you can ask specific questions from our panelists on how you may want to craft your own applications or proposals. Take you here.
Hi, I don't have a question about crafting proposals. I have questions about some specifics. Okay. For Shannon, how do you guys feel about the Children's Village model, and how does that fit into your sort of framework of options? And also, what are you guys doing to ensure care for children with disabilities, chronic diseases, HIV infection, who are particularly hard to place? And for Anna Marie, have you had any issues with cultural acceptability of the food? Because in Bangladesh, when they did vitamin A fortified rice, there were some issues around it being yellow and people not wanting to eat it. So have you had cultural issues, and if so, how have you addressed those? Thanks.
The Children's Villages is interesting, SOS being one of the largest providers, and we've been working with them as well on the transition to the model that they're going to be taking to. I think the Children's Villages is interesting because it's still providing sort of that more family-based setting, but again, working with all of those who are also providing the villages, that not be the primary option, that the primary option be in the family, and that then there be alternative options if the family isn't available. It's interesting because I think for a long time people have thought that children might be harder to place with the disability
disabilities, with the HIV, et cetera. But in fact, a lot of the families are saying that they would be more than happy to take the children. They just don't have access to the services to meet the children's needs. And so working with the governments, and we intentionally chose these demonstration countries because there were different reasons that the children were going into care. So we chose Kenya, for example, because we knew there were large populations of children there going into care because of the HIV epidemic. And so we intentionally chose Kenya to show how we can actually respond to that problem and still meet the children's needs within their homes. We chose Moldova because the large driver there is that children with disabilities become institutionalized. And so what we've actually found is that as long as we can guard the funding that's going into those institutions, if we can keep that funding reserved and we can redirect it back into the communities and back into the families, we can actually get those children the services that they need in a family-based setting, and we can provide more comprehensive care for those children and then also their siblings within their home. Because again, just like Sesame and IRC, the primary point being that children are going to thrive with their caregivers, with that individualized attention, with that love. And so if we can redirect those resources and really ring fence those resources, then we can make sure they still have access to the services that they need within their families.
Good question about cultural acceptability. As I mentioned, when you start adding vitamin A into a crop, it turns from white to orange. So, random fact here, carrots used to be white. They're now orange. Yeah, you do have to tell people why you've changed their food. They do notice it. But here's the great thing. In all of my work in Africa, through many countries, I have yet to find a mother who has not heard about vitamin A. They may not be able to tell you why vitamin A is important, but they know that it's important for their child. And when you can say that this crop that is orange, this sweet potato that's gone from white to orange, this maize that's gone from white to orange, or this cassava that's gone from white to yellow has vitamin A in it, you can see them thinking about this. Hey, wait, I grow this. You mean I can grow this? And it has vitamin A? And what you find is that mothers get that, and they want to include it in their family's diet. And the other thing is that mothers watch their children very carefully, and if you put out, for example, a plate of sweet potatoes, white, yellow, and orange, I guarantee you that the children will pick the orange. It's more beautiful, you know? But a mother's really sensitive to that, and she will make sure that even if her husband wants the white sweet potato, she will have orange in the garden for her children.
Dr. Bosland.
Hello, my name is Martin Bosland at the University of Illinois at Chicago. I first want to congratulate you with this absolutely fantastically phenomenal work. This is just beyond what I expected. I also have two kind of questions that the other questioner asked, and this is about potential obstacles. So in the biofortified crop program, do you have or do you expect to have any competition from genetically modified maize from Monsanto, Bayer? And the Sesame Street IRC program, do you get any pushback from conservative forces within the refugee population?
That's a good question. That could happen. I don't think that we could rule it out. But here's the thing. Most countries in Africa do not have the biosafety frameworks in place for the GMOs to be released and accepted. And there's general negative opinions about GMOs in Africa. And for this reason, Harvest Plus made a decision that if we could do the breeding through conventional breeding methods, we would do so, because our aim is to get out to the farmers, and you want to do that as quickly as possible. As of yet, we have not heard that the big food companies or the big seed companies are interested in the nutritional aspect of the crops. So we haven't seen this happening yet. It could.
As a follow-up question, oh, sorry, Martin.
The farmers, because the yields will be higher because they can spray glyphosate containing pesticide, herbicides, and so I think that's where the danger is.
Yeah, that would be a danger, but we haven't seen it as of yet.
Do you have to constantly supply them with the seeds, or can they replant the seeds from their harvest on their farms?
So it depends on the crop. What we know about sweet potato and cassava is that these are what we call vegetatively propagated. So, random fact, sweet potatoes, you plant vines. So farmers tend to keep the vines over the seasons and they plant them. Cassava, you plant stems so you can reuse. Beans, farmers tend to recycle their crop or their seed. We encourage them to refresh the seed because your yields will be higher, but it doesn't make any difference about the micronutrient that's in there. Maize, on the other hand, tends to be what we call a hybrid, where farmers will buy and each season and plant that seed. Those are hybrids, but we also do have what we call open pollinated varieties, which can be recycled and farmers can plant again and again. Their yields will be lower, but they do have that option.
This is also a question for Dr. Ball from Harvest Plus. It may be similar to the previous question, but I just wanted to better understand the ownership of the seed technology. And yeah, that's the question.
Right, so the agricultural research world is organized into what we call the CGIAR, and the work that is done at that level is public good. And so the germplasm will go into national systems will test and release, and it is public good. This is also why seed companies, to my understanding, and if anybody's from a seed company, you can correct me, seed companies want to own the intellectual property, and they have to be able to go back quite a ways. So if they can't, they're not as interested. So that's how it works.
Take the lady in the middle.
Okay, thank you. I love the fact that we ended the conference with an all-women panel the day after Women's Day with a lovely moderator. I just want to thank you all. I really learned a lot from each one of the presentations. My two questions are, one for Anne-Marie. When I was working in Haiti in particular, I saw a lot of malnourished kids, and a lot of them were lacking in protein. I was wondering if there's any ongoing research on protein-enriched or kind of cheap protein source for malnourished kids that's coming up. I'll be on the watch for that. And then for the IRC Sesame Street, I can see this program being really useful in many developed countries as well for children victims of trauma and child abuse, even for witnessing child abuse and domestic violence. Do you have plans to expand that to as a reverse innovation back to developed countries? Thank you.
So the work that Harvest Plus does is strictly on micronutrients, but I do know that there is quality protein maize, which is promoted with other partners, and some of the legumes, they would also be available as well. But the work that we do is strictly on micronutrients.
So I'll start with the question about. I'll start with the question about sharing sort of from this program to other contexts, including higher resource contexts. I do think we're very aware of the potential for this content, assuming it's developed well, for this content to positively impact children and families affected by adverse childhood experiences really anywhere. And so the things that we're thinking about are how can we create media content that's as adaptable as possible. And there are a lot of production elements that go into that, into making sure that content is relevant across contexts and that it's not so difficult to dub the content into other languages, for example, or to make sure that any characters who appear or any scenery that appears feels relevant and appropriate and local to as many families as possible. The other thing that I'll just flag is we're actually engaging some of that learning internally already. And for anyone who doesn't know but is interested, we have a program called Sesame Street in Communities in the United States that is addressing a lot of these issues and has already created a lot of content that's available online. And we're internally collaborating very closely with them to try to leverage the sharing in both directions to the extent that we can.
We are truly out of time. The panelists will still be around after this session, so if you want to meet and ask further questions, please do so. I want to thank all of you for coming, and I'm sure you'll agree with me if you look at the theme of this conference, Translation and Implementation for Impact in Global Health. We couldn't have asked for a better representation of what that really means. So thank you so much for coming, and I wish you the best of luck as you think about your big ideas that will transform the world. And please join me in thanking a wonderful all-women panel.